Let's talk more then about the new COVID-19 subvariant. We're joined by Higher Health CEO, Dr. Ramneek Ahluwalia. Very good evening to you, Doctor. Thank you for your time. So you agree with the Health Department that at this point there's no need to panic. What then is the appropriate response?
Absolutely. I fully agree with the Department of Health's engagement towards no panic. There's nothing to panic at this moment. This is a new subvariant of the existing Omicron variant. Over 1 billion people in the world have been infected with this Omicron family of subvariants. And it's a new subvariant. Of course, it is of high alert because it's highly transmissible. It's mutated to a level and showing mutations which clearly gives us that it can escape our immune system for a while. But I think South Africa has 80% of its population having something called acquired immunity because they got infected with COVID-19, and specifically in the fourth wave or in 2022 onwards, which allowed them to produce that immune system against the Omicron family of COVID-19, and of course vaccination, which has added into the immune system. So I think there's no need for panic. There will be reinfections, definitely, because this newly mutated subvariant of Omicron family is highly transmissible, which means it can escape for a while, but eventually our immune system should hold its camp. The alert goes to elderly people, people living with comorbidities. Despite they have vaccinations, despite they have pre-infections, their immune systems remain vulnerable. And I think such variants, subvariants that are formed as highly transmissible puts an alert to people who are elderly and people living with comorbidities. They need to be careful.
In the first 2 years of the pandemic and during the lockdowns, we spoke a lot about variants of concern and that sort of thing. Now that we're dealing with a pattern of more transmissible variants, subvariants that aren't necessarily posing a greater risk, shall we say, to the general population's health, should we still be making the big announcements as is being done now with this one, especially when we know that whenever there's an announcement made, without a doubt, some people do panic?
So one thing is for sure, the COVID is still a pandemic and it still remains around us. And it's a disease which is airborne and it does kill. So there is no doubt in that matter. And public awareness, public discussions, public engagements on a pandemic like this is critical at any stages. What we know in 2 years from now, from where we were to where we are, is that it's no longer novel. Means we know a lot about this virus now. We have medical understanding of how to treat people with COVID-19. We can detect COVID-19 early. This was not the case in the past. So I think the important alerts come is when viruses mutate, which is a natural phenomena. The question is when we study a subvariant and it becomes more transmissible, what we're alerting the population of South Africa and we've seen globally is that this virus can again cause reinfections to people. Some reinfections are not healthy, specifically for people whose immune systems are low. So it's an alert to people who are elderly, people who are living with comorbidity, for general population to be aware that there is a subvariant. It's shown high potential of escaping immune systems, remaining highly transmissible from one human to the other. And it's important for people to wear masks if they are in crowded places or in less ventilated places. And it's important to start from putting those preventive measures that we all know about COVID. So such alerts are critical. But one thing is for sure, if I can add, is the fact that it's what we know now is that it's a subvariant of the same Omicron family. Over 1 year, since 2021 late when we discovered this new variant called Omicron, even 1 billion people, it's easily transmissible, it's been moving around freely all over the world, it has not mutated to a new variant. Like the Alpha was a totally different variant than a Beta or a Delta or an Omicron. This is the same family and this is a very good sign for the world that COVID-19 under Omicron is mutating, but under the same family, for which I think the world has an immune system to work around.
Very briefly, people are going back to school and work from this week. Is there a need for companies and schools to relook policies around masking indoors, for instance?
Not yet. We do not have any signs of data suggesting that this subvariant is lethal or severe in the form of infections. Yes, reinfections are highly possible. It's going to be always around. It happens in the flu way when we have flu around in schools and in workplaces. But yes, I would really recommend that people still test early if they are showing signs and symptoms, isolate themselves, and not letting it spread further. People take precautions specifically for the elderlies and people who are living with comorbidities.
Okay.
But I think at this moment, no panic at all for such policies to be developed.
Dr. Ramneek Ahluwalia, thank you for your time today.